oldest granddaughter, she's 13 now, she keeps saying to me, Nana, do you think you're still alive when I turned 19? I said, I don't know. Just ask the man up there and, he'll give me that.
The man up there may have the final word, but here on Earth a range of healthcare professionals are involved in Neri's care. Neri is typical of a patient with multiple long-term conditions. For the past 30 years she's been treated for diabetes and has problems with her heart and kidneys. In New Zealand, 2/3 of adults are diagnosed with a long-term condition. These people place a considerable strain on our health budget. We need a more effective way to manage their care.
Patients with long-term conditions have those conditions over many years of their life, and their care and their needs change during that time. Often their care is quite complex, and so orientating the care with a healthcare team around that individual person is about keeping their health to its best over the long term.
Healthcare professionals across Auckland, Manukau and Waitemata DHBs have been working together to deliver integrated care for people with long-term conditions.
The key component of this is actually the care planning, with the patient at the centre of that, and the patient actually planning their own care with their health professionals, and then following that over time. And importantly then the patient and the person having access to their own information electronically.
I think actually patients believe that all doctors in secondary and primary access their information anyway, but in actual fact we don't. And this is a step towards that, where with their consent we actually do share that information, so we can act on it really in a coordinated way rather than ad hoc.
Neri has been a patient of the Grey Lynn Family Health Centre for more than 15 years.
How's things?
If she has any health concerns, the practice is her first port of call. She also visits the nurse at the diabetes clinic, sees a range of specialists at the hospital from time to time, and drops into the pharmacy to pick up her prescriptions. They now all work from the one care plan.
I think the beauty of the program is that it means that there really is an integration of the sort of information between secondary and primary, and also in the community, primary care and community care like district nurses, potentially palliative care nurses, chemists.
Now it's loose weight.
Yeah. We're obviously integral because we're the medical home, and at least now I can actually receive messages from the pharmacist which can be actioned. There are flags that sort of say, okay, there's a task pending for this lady, go into the shared care management program and see what it is.
Any changes on the medications or anything unusual?
No.
Neri is on 11 different medications, and she relies heavily on her pharmacist's advice. As part of the shared care team, the pharmacist can access Neri's full shared care plan. He helps her to keep her conditions under control by managing her medicines. The system makes it easy for him to communicate any concerns around medications or even suggest changes to her care plan.
Okay, I'll put it in a bag for you, Neri. Okay. As a pharmacist, I'm only looking at just the dispensing side of things, whereas with shared care, I'm actually looking at the whole picture. So I'm actually seeing what sort of health professional sees and what her focus goal is. So it just kind of engages me to not only just look at the dispensing side of things, but look at the whole plan for the particular patient.
Helen McGrinder is a cardiology nurse practitioner at Auckland District Health Board. In her role, she often visits patients at home. The software system makes it easy for her and the patient to enter measurements and notes and update the care plan. This means no more heavy paper files, no transferring notes, no dictating referrals, and no more updating other professionals involved in the person's care.
So that's all about the whole sharing this part of your care and involving the right people at the right time.
Oh, that's really good.
Okay.
Already, patients and healthcare professionals are seeing the real benefits that shared care offers. Patients are engaged and are playing a more active part in managing their own condition. Primary, secondary and community practitioners are finding that shared care helps them to save time, eliminate duplication and become more productive.
The better your communication and the better the sharing of that information, the less likely you are to have mistakes and errors happening.
The efficient shared care system makes better use of our healthcare resources. For example, a health professional can consult a colleague online over a patient's condition without making a referral. It saves the patient and practitioners time.
I can open it up and we can work off it from here.
The virtual consult is a much more efficient way of being able to deliver care when there are specific questions that are needed.
Oh, good afternoon, Neri. Oh, it's nice to see you.
Shared care is changing the way we deliver healthcare to people with long-term conditions.
You got a new prescription from the doctor?
I cope very well. In my doctor and my chemist, they're helping me a lot.
It's important to recognise this is not just another IT project, but this is about a change in clinical practice. This is about how we actually deliver care and support individual people with their long-term conditions.
With her shared care plan, Neri is looking forward to being the guest of honour at her granddaughter's 19th birthday.